One factor that makes the habit of smoking, especially cigarettes, hard to break is because tobacco contains the very addictive chemical nicotine, which the body or the human body quickly gets used to. Despite the health implications of smoking, many in the society cannot do without it, as it has become part of their daily lives. This report, sent by Abubakar Abdullahi and presented from our studio, x-rays how smokers handle addiction vis-a-vis the health implications. The report.
Smoking to many is a daily routine, especially among people between the ages of 25 to 64 years, who form the highest smoking range, while people aged 18 to 24 are the lowest population of smokers in the world. Although no significant benefit is attached to smoking, many wonder why smokers make cigarette intake a habit.
Sometimes it's friends, that is mingle around with friends, sometimes going out in social gathering, or sometimes others just feel like to smoke just to catch fun.
He agrees that despite being addicted to the habit, counseling and other measures can make smokers quit the habit. The Director, Public Health, Nasarawa State Ministry of Health, Dr. Adamu Ibrahim, attributed the habit to peer pressure, social class, and experimental purposes, among others.
People could start smoking for different reasons. Some, they just want to belong, to a group of people that to a social class sort of. And if the social class are populated by people that smoke, they will smoke. For instance, going to clubs, you see a lot of people smoking, and then you are also there, and the tendency is for you to say, okay, let me also smoke.
Dr. Adam, who also said only few are aware of the health implications, explained that majority of the smokers require some level of help to enable them quit smoking.
Majority of smokers may not actually have an idea of the risk they are exposed to in adopting that habit. However, because we also have health professionals that smoke, so you will not say those people smoke for want of knowledge. They have the knowledge. So a few people know the dangers of smoking, but they still smoke. But majority of people do not know the dangers of smoking.
He also speaks on measures to take when trying to quit smoking.
Well, the first things about quitting smoking is that people need to understand the dangers associated with smoking in the first place. If they understand the dangers inherent in smoking, then I think we'll go halfway into the journey. Then the second part is for them to have alternatives to smoking. And in the therapy for quitting smoking, there are different alternatives. We have what we call pharmacological and non-pharmacological substitutes for smoking. But whatever method you want to adopt, it has to be in what we call a stepwise or a gradual manner.
He said government is putting modalities in place to enlighten not only the smokers, but the public to avoid the habit due to health implications.